And let me just make the point. You get into this whole thing about secondary prevention. There's some confusion and some debate about secondary versus primary prevention. So why does that matter? Well, it became an issue with things like baby aspirin. They just said, we don't recommend baby aspirin anymore for primary prevention. Well, what does that mean? Primary prevention is prevention before somebody has disease. Secondary prevention is, somebody has disease and you're trying to prevent it from continuing to get worse. Now, here's the thing about primary and secondary prevention, and here's why it matters, and we'll use the aspirin as an example. For the past 10 years, the past decade, I've not recommended baby aspirin for people that didn't have plaque, and no matter what their age was. So you saw some primary prevention recommendations based on age. 60 or 65, take baby aspirin. Now, most 60 or 65-year-olds that I am seeing I have recommended baby aspirin for, but it's not because they were 60 or 65. It was because we were already in secondary prevention. Now, here's the other distinction. You're making an assumption that secondary prevention is only after you've had a heart attack. I'm saying, no, secondary prevention is actually once we find plaque in your arteries. At that point, we know you've gone down that disease process. Your root causes have already resulted in you laying down plaque. You're not going to lay down any plaque unless you're starting to get inflammation. And the end product of that is inflamed plaque, that plaque leaking into your bloodstream and you having a heart attack or stroke. So once you've got plaque, at that point, I would call it secondary prevention. So after you start looking at that, the reality is the stuff we talk about on the channel, there are some significant distinctions. All of the lifestyle stuff, you want to keep minimum of body fat. You want to keep up your muscle content. You want to decrease carbs. You want to know if you have a carb metabolism problem. Here are the distinctions. I don't recommend baby aspirin if you don't have plaque. So no disease, no baby aspirin. No plaque, no baby aspirin. If you have plaque or if you've had a heart attack, I recommend baby aspirin. Unless, of course, you have atrial fib or something like that, in which you need something different from baby aspirin. You need what we call a NOAC, a novel oral anticoagulant, like rivaroxaban, Xarelto, Eliquis, that sort of thing. The other major distinction between primary and secondary is the topic that we talked about today. I don't recommend statins if you don't have plaque. I've got 69-year-olds, a 70-year-old or two even, that don't have any plaque. If you don't have plaque, I don't recommend that you take a statin. So the key distinctions between primary and secondary, in my mind, are not whether you've had a heart attack or not, but whether you have plaque or not. And the key distinctions between what you should do differently are statins and baby aspirin.